and they think there's a belief that women, ironically, process pain differently.
Yep.
Like we're more tolerable, right? And
Yep.
then Black women, like you can experience the utmost amount of pain, and
Yep.
that's not reality.
All right. So today I have Sheena Franklin on the show with us today. She is a senior healthcare public policy professional and also the founder of a startup called Kept Health. So before we hop into the conversation, Sheena, firstly, thank you for being here. And I want to do a check-in. So how are you doing PMS? So physically, mentally, and spiritually today?
So physically, I would say I'm doing good simply because I started working out. I try to work out every morning, not like an hour, like
Mhm.
20 minutes, 30 minutes just to get me flowing. And if I do that and I don't check social media, then I'm like, my day is like especially different,
Right.
better. Spiritually, I think I'm doing good.
Mhm.
Today's a good day. It ebbs and flows, but you have to
Yep.
keep faith and hope.
Yep.
So I'm doing good there. Mentally, man, it's like a roller coaster. I just think
True.
any type of company, organization, effort that you start, whether it's like a big company or maybe it's one of the local organizations you belong to, it takes a lot, right? Because you want to do a good job, then you get nervous, like you don't want it to fail. You want to make sure that you're serving people. So ebbs and flows. But
Yeah.
I would give myself like a 95
Oh,
today.
that's pretty good. Okay, I
Yeah,
love to hear it. Good, good. So today is a good day for you
it
overall.
is. It
I
is.
love to hear it. So this is something that I recently started asking my guests because I want the audience to get into the habit of checking in with themselves too. My
Yeah.
my best friend, she learned this in therapy. So I have a bad habit of how you doing? The world might be falling apart, and I'm just like, oh, I'm good. And she's just like, all right, let's break this down. Let's be real and let's walk through it. So yeah, I'm happy that you walked through it with me, and I'm happy that overall 95 is a really good. That's an A+. So I'm
It
happy
is
you're doing
today.
well.
Thank you for asking.
Of course, of course. So, what led you to founding Kept Health, and what is Kept Health?
Yeah, so I will start by explaining what kept health is, right? So there's a larger component of kept health where we're really striving to transform women's health, and making sure that when we're creating products, whether that be drugs or over the counter, whether it's research, making sure that when we do these studies and create these initiatives and innovations that they include women, but they make sure that women of color, that we stay on par with our white counterparts or that we're
Mhm.
actually included. So that means we created what we call a health tech or a healthcare and data and analysis company. So
Mhm.
we're all about how do we responsibly collect data and use AI to transform care. And so for me, when I was looking at ways is how do I apply that, which was creating a teledermatology platform, right? So that all women, but in particularly looking at women of color, but even more so looking at Black women, um, making sure that we had affordable and accessible care to get to a dermatologist, not just because, we want to deal with rashes or acne or what other type of disease we may have, but it's because so many of the health issues that we face, those early warning signs show up on our hair, scalp, skin, and nails. And a dermatologist is more likely to spot that and diagnose women of color before a primary care physician.
Wow, interesting. A couple of things that I just thought about as you were talking. I recently learned that a lot, like when let's say a skincare company makes a claim about how it's going to affect the skin, let's say it's like a brightening agent for like hyperpigmentation. I learned that we aren't even in those studies. Like our skin type and the how melanated it is typically isn't necessarily included in those studies, so in those claims. So is part of your work to address that as well?
So a bigger vision is to do that. So what we're doing is tackling that in two ways. One, making sure that I'm going out and I'm saying like, hey, I'm collecting the information. I'm bringing these women together in a community. First and foremost, I'm making sure they're getting care and they're comfortable. And then I start to work with different companies and say, if you want to reach out to my community to have them involved in your efforts, these are the ways that you need to do it. Right. So
Gotcha.
it's both ways with the data, but then also presenting our community with opportunities to be involved, whether it's the skincare product, whether it's a wellness brand, nutrition supplements, all the way to aspirin, which I don't think people a lot realize, and then also all the way up to a particular drug that we.
Okay.
Mhm.
And you made the you know mentioned the comfort so that our population is comfortable with their provider. What I've noticed is, and I'm not sure if it's always been like this, but I realize that there's a huge distrust in our community with the medical community with good reason. So how do you get participants who are willing to be open and transparent with providers and to exchange that data and things?
Yeah, so we do it in a couple of ways. So when you come into our platform, we make sure that we're meeting your needs first,
Mhm,
right? So that's all my platform is about. Like whether you need to speak to a dermatologist or right now we're connecting you with people in your state,
mhm,
we make that paramount. Whether you want to talk to an esthetician, we make that paramount. Or whether you want to make sure like I have my at-home routine and everything I need to take care of right there, right? We make that in the palm of your hand. And then we also make sure that we're bringing experts to
mhm,
have like 30-minute chat conversations once a month where you can come on and ask a question, right? Like
mhm,
next month, we're going to be doing protecting your crown, everything you need to know about your scalp and your hair, right? And then another one about meditations and reducing stress, and that decreases flare ups. So we make that the priority first, right? Making sure we're solving that problem. Then the
mhm,
next problem, we're saying, like, hey, if you want, here's this opportunity where you can engage,
mhm.
right? But because we provided you with care and because we provided you with these vetted physicians,
Yeah.
that's going to make you more likely to say like, oh, well, maybe I'll go this time. Or even
Yeah.
we have women who take our mobile app with them to their oncologist or to their gynecologist as a way to help with feeling comfortable and having a way to do self-advocacy at the same time.
I love that. I
Yeah.
feel like I've heard a similar model when it comes to like pregnancy care. There's a couple of apps, and I think what I've been seeing is that it's been made a huge difference in the level of care that those patients have received because, like your organization, they're patient-led and not necessarily physician-led.
Exactly.
That makes a huge difference. And you mentioned self-advocacy. So recently in the news, I think maybe like a couple of weeks ago, there was a popular influencer who this is a bit of a tangent. Popular influencer who unfortunately was misdiagnosed as having fibroids, and then it ended up being like stage 3 or 4 cervical cancer. So that brought up the conversation about self advocacy in the healthcare world. So for those who may not know, what does that look like? How can we advocate for ourselves better when dealing with the medical complex?
Yeah, so I'll probably say something that's probably might be a little bit controversial is that you have to take your doctor off of a pedestal, right? Like,
Mm-hmm.
you cannot give them so much autonomy over your body, right?
Yep.
Especially as women. And you know how it is when you go for those types of exams, you're like exposed,
Yep.
right?
Yep.
So start there, take them off the pedestal, and go in with the open mind, but being cautious.
Mhm.
And if you don't understand a particular term or a concept, have them write it down on a piece of paper, and then you can go do your own research. Not all the time, Dr. Google isn't always the best option, but it's a way for you to start, right? Um, then after that, I would say if the doctor is speaking too fast, you can say, slow down, I don't understand,
Mhm.
right? After that, you can say, I don't agree with what you're saying. Like you can have that give and take relationship. And then also, even if you're doing Dr. Google, you mentioned it before, you can go to the app store. I know this sounds wild,
Mhm.
but you can type in like fibroids or women's health, and you will get different types of apps that will help you track different things. And then once you log in, they typically have articles from specialists, right? So those are different ways like you can kind of maneuver around the system. But even if you feel, you're not getting the best care, you can always find another
Yep.
doctor.
Yep.
And then last but not least, controversial, you can also complain to your health insurance company about a doctor,
Mm.
right? So doctors, they have to have a good standing license,
Yep.
right? There's malpractice for a reason.
Yep.
So you know how we tell, like we go somewhere, they didn't give us what we wanted,
Yep.
like, hey, you're not going to get my money. Well, I'm not going to pay this hospital bill because I was treated this way.
Mm.
That's always an option too.
Yeah. I really appreciate the first point that you made is to take them off of the pedestal. I think a lot of times, whether physicians mean to or not, but they have this idea that, well, because I've studied X amount of years and I know the essentially like the medical algorithm of what's likely to happen and whatnot, that they know best. But I think it's super important to remember that you know your body best. You
Exactly.
are with yourself 24/7. So you may not necessarily have like the clinical knowledge to back it up, but your intuition, that thing is strong. And if it doesn't feel right, like speak up for
Mhm.
yourself, do all the things that you mentioned as well, for sure.
Yeah. And you can't give up, right? If you know something is wrong, I think we kind of just want to give up, but you can't give up. Like,
Yeah. You know, the thing that makes me sad is that let's just say somebody is diagnosed with something that's kind of serious, right?
mhm.
Hard when you're dealing with whatever physical stuff you're going with and then having to be mentally strong to now, excuse me, to now have to like advocate for yourself. Like that's also another level and
Mhm.
energy, like, draining thing. And I hate that that is the predicament that we have to be in. So I'll add to have somebody with you.
Yeah. If you
Support
definitely can
system.
have someone there with you, a support system, um, yeah, that's a good one
Yeah.
too.
Yeah, I'll add that. So I kind of want to shift gears a little bit and talk about what is bikini medicine.
Yeah. So that's an interesting term, right? And it's this misconception, right? That was probably put out, I want to say in the 70s, 80s. And it was the belief that um, women and men experience health issues differently,
Mhm.
right? Especially when it comes to our reproductive organs or anything that needs to be treated that fits under the bikini, right?
Okay.
And so that then impacts research, that impacts the way your doctor will think about what you're saying because they think that we are different, right? And then
Mhm.
so when you move into the future of healthcare, if you will, when we talk about women's health, right? That's why a lot of women's health really primarily focuses on reproductive health,
Yeah.
not realizing that there are tons of diseases that disproportionately impact women or impact us differently that go without
Yeah.
any type of research, right? So even right now, there's just like a dearth of research and data on anything about us as women outside of our
Yeah.
ability to give birth.
Yeah, for sure. I was actually just talking to my husband. Excuse me. He's getting a vasectomy tomorrow, actually. And they were like, I'm like, well, so what did I tell you to do? He's like, well, he said 3 days. I gotta, just do nothing. I gotta really lay low and relax for 3 days because it's intense. I'm like, women have whole C-sections and are sent to take care of a newborn after they've been cut completely open. And they're telling
Yes.
you that you need 3 days. Let's go ahead and crawl out, lay down, take it very easy, don't do anything. I'm just like, that is something else. And I think it has to do with all of the things you were just saying too, the way that women's health, women's everything is just kind of an aside. It's not really taken all
Yeah.
that serious.
And they think there's a belief that women, ironically, process pain differently.
Yep.
Like we're more tolerable, right? And
Yep.
then Black women, like you can experience the utmost amount of pain, and
Yep.
that's not reality, right? I think it's a combination of, um, as you said before, we just have to take care and do what we have to do,
Yep.
right?
Yep.
And so when you were speaking of that, reminded me of someone that I know who had a hysterectomy, right?
Mhm.
They're in and out the hospital and you lay low, but they still want you to come back, right? They don't
Right.
say lay low for 3 days or 3 days afterwards. We're not going to send you home unless someone's there
Yep.
with you, right? It's like, well, we
Nope.
we took all basically your female organs, but
Yeah. Go
you're
ahead.
okay.
Yeah, let's
Yeah,
go back to your regular life. Yeah, for sure.
exactly.
And even when we talk about like heart attacks, like what we typically know as the signs of a heart attack is really how it usually typically presents in males and not in females. So we don't even learn those signs till later. And yeah, it's a mess. And I
Yeah,
think it's a combination of sexism and then how Black women are also then later excluded from studies racism. And it's just hurting us all collectively.
exactly. And then there was one other point I'll put into that. It's the way that medicine is taught as well,
Mhm, mhm,
right?
mhm.
So that's a big part of it as well. And that leads to biases and that leads to exclusion. It leads to so many different things. It's such a multi-layered um, process.
Yeah, for sure. And I think because many of the medical schools, even though they might be quote public, a lot of the funding does come from the pharmaceutical companies, right? And I think at the end of the day, this is going to be controversial. It is profitable to keep the population sick, you know? So it's going to be, it'll take a lot, like a whole restructuring of the educational system to really change things for sure. Even just including classes about bias for real, like not just like a one semester thing, but to have that continuously as part of the education really is a place to start. But that,
Yeah. So I think you're touching upon like a bigger issue. So healthcare in the US in general is just like sick care, right?
yeah, yep,
It's not healthcare. It's not
yep,
preventative care.
yep,
So many parts of the process is made, money is made by having us sick. Like
yep.
that's just the reality. And it makes me think of when I was going to speak to investors, and one was, well, what will happen once you help women, for 6 months and you help them clear up their, acne, and they found out it was because of like PCOS, or maybe they lost their hair and their hair's growing back, and now you help them solve thyroid disease. So then what happens now? How do you
Right,
make money? And it's like, well,
right.
there's an extension. We
Mhm.
just don't exist inside of the clinical setting, right? We have to maintain that. Like I
Right.
can't just go out and buy any random product, when things happen. Maybe, I gave one mundane answer. Maybe I just forgot to take medicine, or maybe I wanted to buy this product because it was really, Beyonce did it. I don't know. But it wasn't good for me. You know what I mean?
Mhm.
It's my issue. So there's always something going, but we are definitely a sick care um
Yeah,
society.
yeah. So you touched on the how we're not necessarily looking at preventative care. So, what is your vision for addressing like the holistic wellness of the people on your platform?
Yeah, so that's a great question. And it's why we focus on dermatology first,
Mhm,
because your skin is essentially a window into what is going on internally.
mhm,
So, any type of illness, whether it's diabetes, thyroid disease, lupus, cardiovascular, gut health, anything like that, it's
mhm,
going to show up, whether
mhm,
it's a rash, hair loss. So, that's where we start.
mhm,
Um, and then we make sure to bring in a physician when you're ready or where you need it. So you
mhm,
always have that option. And then also what we do is we bring in the nutrition part. So every time you meet with one of our folks and you need to have like a diagnosis, we include like any nutritional tips that we think
mhm,
may help you. And then we also do meditations, right? So it's all about mind, skin, body connection. Like we've been taught that our body is a set of like,
Yep. Organ
separate
systems.
organs, but they're
Mhm,
all connected, right? And
yep.
so we want to make sure that, you're de-stressed, you're happy, you're calm. And then also if you are have a particular skin disease, so like eczema, psoriasis, or maybe you have another internal health disease where you need to keep your stress level low, we
Mhm.
have meditations for that as well. So like that's how we involve the whole person
I
into our.
love that. I
Yeah.
love that so much because to your point, we typically think, well, if it's my skin, let me just, take care of the skin, whether I just go buy like a product, I put makeup on it, let me just cover up this part and not do the deeper investigation as to what could be causing this eruption on my skin. You mentioned earlier in the conversation about how a lot of things are diagnosed via the skin, the nails, the
Mhm.
scalp. Can you talk a little bit more about that?
Yeah. So that's actually dermatology, which a lot of
Mhm,
people don't realize that that's really dermatology. And I did it until years ago when I had my own skin issues, which
mhm,
led me to starting this company. And I just could not find like not just the right doctor,
mhm,
right? One who was just a nice person, um,
mhm,
someone who understood how to treat skin of color, right? And then someone who understood women's health. Because I
mhm,
really felt like it had to be like hormones. Like I
mhm,
was hitting like my mid 30s, like,
mhm,
you know, um, and so that's just kind of gave me the insight. And then when I found like a great dermatologist who's now our advisor, she was just like, yeah, this is how we look at your skin. This is
mhm,
what we're taught. Even primary care physicians are taught, internalists are taught that as well.
mhm,
So they're looking at your skin while you're going to the doctor. You may not know it,
mhm.
but they're looking at your skin to pick up on these different signs. And so different diseases do different things, right?
Right.
So vitamin D deficiencies, any type of deficiencies will first show up in your nails, right?
Mhm,
Like they're cracking, they're discolored. Hair loss, I talk about that a lot just
mhm,
because big issue.
mhm,
Um, Acne always isn't just acne.
mhm,
It could be fungal acne, it could be a sign of PCOS, it could be a sign of like menopause,
mhm.
obviously. And then also when you're going through a treatment like chemotherapy, it's also important to make sure that you're taking the right skincare steps so you're not having lasting damage from the chemotherapy.
Yeah, yeah. This is also like a good reminder for us to like really spend time with ourselves and like investigate ourselves without anything. So like a lot of us wear nails all the time so that way we don't even know what our natural nail looks like how is it doing? A lot of us wear protective styles and I'm one of those people
Yeah.
constantly. So I
Mhm.
become disconnected with my hair and with my scalp. And then like when it comes to skin, when I was going through some acne postpartum, I was like, well, it's just postpartum and I'll slap some foundation on it and keep it moving. And I think this is just a good reminder just to get to know yourself again and to spend time with yourself again. So you know what your normal is and when to seek, help and everything.
Yeah, that's a really great point. And it made me think of there are the yearly skin exams for skin cancer. I think
Mm-hmm.
it would just be really good to start implementing your own once
Mm-hmm.
yearly like skin exam for
Yeah.
yourself.
Yep,
Mhm.
for sure. And I think for the most part, the skin exams are typically said, oh, if you have lighter skin and if you have moles, go get those checked annually. So kind of for me, I have not been to dermatologist since I was at like in maybe high school. So for me, it makes you think, well, that's not important for me. But no, I need to get my skin looked at by a professional because there are things that I just may not notice for sure.
Exactly.
Yeah. So good. So we talked about what bikini medicine was. I also want to talk about what are some common barriers or challenges that you feel that women of color may experience when trying to access or advocate for themselves.
Um, Disbelief,
Mhm.
and I'm gonna say that we somehow are uneducated, just in general,
Yep.
period, right? Not
Yep.
necessarily disbelief, but put that in a different category. And be prepared for that, right? I think it's easier said than done because when you're
Mhm.
in those situations, right, either we are really outspoken or we shut down,
Yep.
right? So regardless if you're the most outspoken person, sometimes I find myself I'm really outspoken with one doctor, another doctor I'm just like,
Right. Yep.
I don't know, you know what I
Right.
mean?
Mm-hmm.
So those are the challenges. Again, like you said, having somebody with you. But I just believe preparation is the most important thing, and understanding that there is nothing wrong with you,
Mm-hmm.
right? Even though language is always put, I don't want to say like the victim,
Hmm.
but there's nothing wrong with you, right? If you go somewhere, we're talking about dermatology, and they say something like, oh, you can't use this because you have dark skin, or you can't do this laser because, yes, you're light, but you have melanin. So your skin is the issue. No, no, it's not my skin
Hmm.
is the issue. Your product, your laser, your education is the issue, not
Yep.
me.
Yep.
Right. And then again, if you are in those situations and you're uncomfortable, you can leave
Yep.
and you
Yep.
don't have to pay the copay. I know some doctors are gonna be mad when I tell you that, but
Yeah.
you don't have to pay the copay.
I appreciate it. Yeah.
Right?
It's good for us to know, like, take some ownership and feel like whole, like beings, adults again, because something about being in that setting oftentimes makes you feel
Yeah.
small and not quite like a grown woman anymore. So
Yeah. And
yeah.
just fundamentally know that you are not the issue. Right.
Hmm.
Yep.
Hmm. I kind of want to go back. You mentioned how you found a dermatologist who also knew about women's health and all of those things. How do you even find it? And knows Black skin as well. I think a lot of us will say that we shy away from dermatology because it's hard to find somebody who
Mhm.
fits our skin. Even though they may have gone through residency and finished medical school, they may have not spent time working with our population. How did you find
Right. Like the
this
holy
corn?
trifecta.
Right.
Um, I would preface by saying I am in the DC area, right?
Okay.
But that was still challenging though, right? Because those other two are important. And I wish I could say, like, I sat in front of my computer, I did research. It was me, dermatologist after dermatologist after
Mm,
dermatologist after dermatologist, right?
yeah.
And then me saying, like, I'm not going on Accutane. Like, I'm not going to do that, right? So then
Mhm.
me trying to find an esthetician, an esthetician, and an esthetician. So it was like, I had to do all the work myself. And I
Yeah.
was like, some people are not going to be as fortunate as I was. You know, the position that I had where I can say I'm taking off for an hour and a half because I'm going to the dermatologist on Tuesday and I'm going on Friday. And
Right.
that's just what it is, right?
Right.
So, like, everybody doesn't have that, right? Or everybody doesn't live in a DC, Virginia, Maryland, right?
Mhm.
Um, and so that's where I was like, once I got into the system, I started to know where the doctors were. So that's why I said, I'm just going to create a service where women can come to my app, whether
Mhm.
you get a telehealth visit or not. If you just say, hey, I just want a list of vetted, dermatologists, estheticians, nutritionists in my state, then we'll
Mhm.
give that to you. Because
Mhm.
it's just a lot of unnecessary legwork that we
Yeah.
have.
Yeah.
I just
Yeah.
kind of want to eliminate that because I know that a lot of us would go to the dermatologist
Mhm.
if we knew like this person on the other end had the education and the cultural competency to
That
work with.
part. That part for sure. And then I also want to know about the nutrition piece. So, based off
Yeah.
of your experience, what are some just general big picture things that we can incorporate in our diet to have optimal skin or just optimal health in general?
Yeah. So definitely lots of leafy vegetables, which is
Mhm.
very hard for me,
Mhm.
right? Leafy vegetables, a balanced diet with fruit.
Mhm.
I'm not someone, and our team isn't someone, a group of folks who always say you have to be vegetarian or you have to be vegan or you
Mhm.
can't do things like that. You can have everything in moderation.
Mhm.
Another thing is, I know it's like a big debate in the social world is water, right? Water is not going to clear up a,
Right.
but it's about staying hydrated on the inside. So that's really important. Another thing that we talk about is alcohol consumption. So it's not to get rid of alcohol, it's about doing it in moderation. And then finding a vitamin supplement, and that's going to look different for different people.
Yeah. Yeah. Oh, so good. So, so
Yeah.
good. So as we wrap up, I have a question that's more personal for you is
Mhm.
as a startup founder, which I know is probably very, very stressful, how do you pour into yourself and take care of your well-being as you're helping to care for others?
Yeah, it's a good question because I did it. What's today? I did it Sunday. I
Mhm,
totally disconnect. When I
mhm.
mean I disconnect, I disconnect. So it's like no TV, no cell phone, no social media, and it's just me and quiet if I can get it, depending on who's in the
Yeah.
house, but just quiet. And then sometimes I'll go for long walks.
Okay.
And just for me, like walking next to like a river or a lake is just like
Yeah.
the most serene thing. Now, when I was younger, I was like, this is totally like, why am I here? But now it's like this is my safe space.
Yes.
Right? So that's what I always tell people is try to find ways to just totally disconnect
Mhm. Yeah, and
and
that
just
time
be by
in
yourself.
nature. Yeah, yeah,
Mhm.
and that time in nature is something else. There's something about for me, it's body of water too. The water
Yeah,
instantly calms me, and just seeing the greenery it just brings me back to center. So,
yeah,
yeah.
it does. It does.
Yeah, yeah.
Nature. Who would have thought, right?
Right? Thank you so much, Sheena, for being here and for chatting. Where can the people find you? How can they connect with you, the app, all of those things?
Yeah, so you could find us on Instagram at Kept Health.
Mhm,
And then you can also check us out on our website at getkept.health. And you can
mhm,
learn all about the mobile app. And then also for more resources, please download the app. It's completely free.
mhm.
You do have to log in because it's a healthcare app. So we want to make sure that all your data and everything is protected. But again, it's totally free. So take
Okay.
advantage of all the resources. Yeah.
So I will definitely have all those links down below in the show notes. That way it's an easy click for you to go
Yep.
ahead and follow on social, get the app, check out the website, all of those good things. Thank you, thank
Yep.
you, thank you.
Absolutely.